According to Environment Canada, it's being carried south by shifting winds from fires burning in northern Alberta, the Northwest Territories, and even BC. Now, unfortunately, meteorologists expect it to linger clear through the weekend until at least Sunday night. Now, with all of this smoke being a fixture of Alberta's summers, we're taking a look at its effects on both your mental and physical well-being. While society is largely aware of the physical risks of smoking cigarettes, the dangers of wildfire smoke are less commonly appreciated. Respirologist Dr. Ann Hicks says breathing this smoke in can have serious consequences for your health.
Some of it'll get up your nose and into your airways and make you have a sore throat, and your eyes might sting and itch. Once you get to smaller, it can go down into the depths of your lungs, where it causes inflammation and damage to the lungs.
Short-term exposure is bad on its own, but the weeks and months of smoky skies we're dealing with have cumulative effects with prolonged exposure.
And the very, very ultrafine particulate matter actually gets absorbed into your bloodstream, and it can have impacts on your brain.
Hicks says breathing the smoke can impact child development, contribute to dementia, and cause heart inflammation. She says we need to pay attention to the air quality index.
When you're in the orange or red zone, where it's considered dangerous, nobody should be exercising outdoors, nobody should be working outdoors, and you should try and stay inside out of it as much as possible.
She recommends keeping windows closed and using HVAC systems or HEPA filters to clean indoor air. The doctor says if you still have to be outside, studies have shown N95 masks filter 85% of the smoke particles out. But as these conditions persist, they can also impact our mental health.
There's the worry for our health. There's the concern for not being able to do what we want to do. And then I know in talking with some people, there's the real true concern for our environment.
Registered psychologist Dr. Angela Gray says while it can be frustrating to have to repeatedly cancel outdoor plans, we need to put our physical well-being first and have backup plans in case of smoke.
We really do have to be adaptable and think about, okay, well, those plans changed. How can we do something indoors that is maybe not equally as enjoyable, but is also calming to our nervous system?
Back to this smoke event, the city of Edmonton has activated its extreme weather response for poor air quality. It came into effect this morning and is scheduled to remain in place for 24 hours, but of course it could be extended. Now, while it is activated, city facilities like rec centers and pools are open to anyone seeking respite from the smoke. Now, the city is also giving out N95 masks to local social agencies to hand out to vulnerable Edmontonians. Back to you.